You'll see a lot of that from the specialists, because I'm not going to want to be crammed down to the economies of scale. Our system's not going to be able to handle healthcare reform. There's no way. Severance plans is one I bring up a lot too. A lot of times we do what in severance plans? I will pay your healthcare premiums for 3 months, 100%. Do I pay all of my other employees 100%? No. Have I created a potential healthcare plan or a discrimination issue by paying your healthcare premiums and nobody else's? Or I'm going to provide you access to our plans. You have to be very wary when you provide severance plans now of how you term what I'm doing in terms of healthcare premiums to not raise a discrimination issue. I'm not saying that every time you have a severance plan and you provide healthcare premiums, it's a violation, but I can give you a number of examples where it is. Like my first one, we pay your healthcare premiums 100%. If you didn't write that correctly, that would be a violation.
So an alternative would be to have them elect COBRA, and then you pay their COBRA
Right.
for a set period.
Exactly.
Yeah.
Or I give them a lump sum,
Right, just a.
and I give you $1,000, and it happens to equate to 3. I agree not to kick you off the plan if you in fact agree to continue to pay the premiums. And it was going to have the likely issues are going to come when your departing execs come, and they say, "Yeah, I get it. My run's kind of over, but I want to remain on your plan for 39 months." And if anybody's been in HR, they know the business owner comes to them and says, "Yeah, this guy's going to need to remain in the plan for the next 4 years. Can you please enroll him?" And they also have a sister that also agreed to put on the plan, so you need to enroll them tomorrow. That happens a lot. And so these kind of issues need to be thought through now in terms of how they impact discrimination. Because if I have an insured plan, they're all part of the plan as participants. So Susie's exactly right. COBRA is the best way to go, because I can pay whatever I want on COBRA. So effective 2011-2012, what's coming up? Very little, which is the good news. So you won't have to attend a seminar from me for another 2.5 years, which I know is disappointing. I'm sorry about that. Almost all of the laws from 2011, 2012, 2013 deal with medical insurance in insurance companies. So you will see very, very few changes to your policies and contracts in the 2012 renewal year and the 2013 renewal year. But that should scare you a little bit only because I only said 2 years. You have essentially 2 years of contracts that will look pretty much the same, and the whole world is going to be overturned in 2014. I don't know if you'll have health plans, I don't know if there'll be exchanges. We'll be talking about a whole different world of commentary at that point. But everything's going to be about medical loss ratios and getting insurance companies ready for healthcare reform. There are a few provisions, though, that matter. And I talked a little bit about insurance administrative efficiency. If you know anybody who works for Providence, ODS, Kaiser, Regents, they're all putting in these major software systems to handle healthcare reform. And it's what's called administrative efficiency. One thing I do note for people is I think you're going to have some level of responsiveness problem with the insurance companies for the next year. And the reason being that a lot of their good employees have been moved on these admin efficiency teams. And they're going to be a little bit shorter staffed, and they're gearing up for healthcare reform, and they're not going to be as mindful to your plans. And you need to be aware of that, first of all. But second, you need to push on it. And you need to demand people respond, not sort of be okay with not getting the answers, because you're still paying the same money. Summary of benefits in 2012, I do think the 60-day notice will be required as of 2012, March 23rd to be exact. The summary of benefits is March 23rd, they're linked, and that's why I think the 60-day notice is effective then. So you will be required to have a 4-page glossy picture of a guy looking like this, who gets hurt, who then goes to the doctor, who gets okay, and then hands a bill back, and gets paid and smiles. It needs to be understood by the actual person. So you will be required to put that out in 2012. We are now sitting in 2010. We are 29 days from being 2011, which means your next cycle after this year, you will be adding a disclosure piece to open enrollment. And it will be a nice summary of how do I get coverage on this plan. So essential health benefits is the real last meaty issue I want to talk about in the last 10 minutes or so. I'm going to go through a few other slides. Essential health benefits and preventive care is what you need to care about for the next 2 years. This is where the money meets the mouth. It's where the rubber meets the road. If I had any more cliches, I would tell you. These essential health benefits is what I'm required to cover. There's a laundry list of what it means, but what is important is what we don't want. I do think creative self-funded plans will start moving to, and even some insured plans, I cover essential health benefits only. In fact, there's some guidance from the government that says that they're not even sure that self-funded plans have to cover essential health benefits. So you could see people buy insured plans for essential benefits and then self-funded plans for the rest. I think is another way people will start to go to save money. I'm going to cover your preventive care. Mike can tell us that 91% or so of all people only, they have very small claims. Most of your claims are your top 9, 8, 10% of people, and those people tend to have huge claims. So in the healthcare delivery world, most people, particularly the women, because again, guys think they're invisible and don't go to the doctor, they tend to have under $1,000, because a lot of women will go once or twice a year for a checkup. Most guys won't go unless their bones are sticking out of their bodies, at least on the age of 50, and then we go a lot. Because then we're all hyper-different. My dad's like, doctor every other day now. I think this is happening, I think this is happening, I think this is happening. No, you're just getting old, that's what happens. So what am I going to cover? What do I have? I'm going to start looking for a delivery system that covers those 1,000 people fairly cheaply, with a 91% $1,000. And then everybody that does go to the doctor tends to have $10,000 or more, because if I go, and I go more than once or twice, it tends to be an actual issue which I've either been hospitalized for, or I have a surgery or something else. And childbirth is not part of this. Childbirth is actually a fairly cheap experience, despite what people tend to think. It's not cheap having kids, trust me. It is cheap birthing them, apparently. We actually have one of mine at home, which is the cheapest way possible. That was an accident, and I miss it. So my wife still holds over me. But she had it like in 15 minutes, and I don't know anybody that could get from one place to another in Portland without any prior notice in 15 minutes to witness their kid's birth. Essential health benefits are listed at this. She also had the kid on my daughter's bed, which we have not told her. Ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse, prescription, rehabilitative, laboratory preventive, pediatric services. Okay, there's a lot of things that aren't on there. Run-of-the-mill surgeries, anything kind of elective, something that's argued, but I didn't cover. What the healthcare system's going to have to decide is whether they want people going to emergency to get things covered, which they don't want, which is why we cover those things today, or whether we start to have buy-up plans or more participant choice in those issues. I do think this is where we're going. I think we'll see plans start to cover these basic points, and we'll see companies start to say, we are happy to cover the rest, but we're going to have some level of participant engagement in that process. We're going to go to a basic plan. If you have an emergency, we're going to cover it, and we're going to define it as a real emergency, because we're going to start denying claims where you went to the ER that weren't actual emergencies. We're going to have ambulatory services if you're hospitalized for something, if you have mental health, which is a parity issue, newborns, birthing, lab services, drugs, rehabilitation, etc. We're going to cover you, but we are not going to cover you for other things, or we're going to require you to cost share. That will not happen, I don't think, until 2014. But this list is important to understand for this reason. This is the future of healthcare reform. You will cover these benefits because you have to, at least until you drop your plans for the financial reasons I said earlier. And you may not drop your plans just to cover this. That's also the other part of this. We talked a lot last year here about the cost, the penalties, and $2,000 a person if you drop your plans. I do think it's going to be cheap to cover this versus the $2,000 per employee. And so a lot of companies may decide to go that route, but they're not going to cover everything. We haven't had a lot of guidance beyond this, so I don't know what's essential. The claims administrators are putting out stuff. Some stuff I agree with, some stuff I don't. There's some diabetes coverage, some other things I think is arguable that they're covering today. But right now I would argue you err on the side of essential. Most of you are insured, so you're going to end up just following what the insurer does anyway. But this is how you game the system, so to speak, in healthcare reform in the next few years. Notices. I talk about wrap documents all the time. A lot of you probably don't have a wrap document, but it's a document. When you have an insured plan, you have to go to the state of Oregon, and the state says, yes, I agree, or no, I don't. It's not a federally governed plan. The insurers try really hard to put the notices in. They don't always get there, and some of them just don't care. You, as the employer, are responsible for the notices. You are also responsible for when you wrap a bunch of plans together, you might get your dental plan or your vision plan subject to grandfather or healthcare reform, because in your wrap document you say something like, dental plan, this plan covers dental, medical, vision, disability, etc. So you'll have to be mindful in wrap documents to make sure that this is for compliance purposes only, but does not impact healthcare reform, etc. So we've tried dropping in a little provision in there that talks about grandfathering and healthcare reform. But it's something to be mindful of if you have wrap documents out there. Grandfathered plan notices are required. You're required to say that you are grandfathered. There is no accidental grandfather. You're not allowed to find out later, I wish I was grandfathered and I didn't tell anybody. If you don't tell them up front when you enroll in a plan, you are not grandfathered. Summary of plan benefits I talked about, notice the changes to the plan in 2012. There's an automatic enrollment provision that doesn't have an effective date, but I would not urge anyone to start automatically enrolling people without some guidance from the government now, but it does exist, and it will happen. You will all move from open enrollment as an election and signature to an automatic enrollment sooner or later. Don't forget other notices too. There's a lot of discussion on healthcare reform, which is making people forget about laws that are affected this year, like CHIP, Michelle's law, GINA, which are largely, I have to go out and send a notice to my employees that say we have a CHIP policy. Oregon has a CHIP program wherever you have, it's a children's health insurance program. Michelle's laws is a dependent age issue, which is largely moot due to healthcare reform, but it still requires a notice. And GINA is a Genetic Non-Discrimination Act. So you still need to go out and inform people now that you don't discriminate based on genetic information. That likely comes up in health risk assessments. Okay, I asked this at all the presentations. Now, will open enrollment be the same? I think it's very important for anybody involved in health insurance. The bane of the Facebook post year that I see on people's walls, so to speak, is open enrollment period. Everybody universally hates it because everybody comes in and says, well, I want this, and of course there's the 30 people the day after open enrollment say, I forgot to sign up, can I please get my stuff in? Then there's the one in January who says, oh, I don't think you told me, I sent you this notice. No, I don't remember getting it, you have to argue it. So open enrollment's a problem, but I think it is going to change dramatically. There's going to be automatic enrollment. It will come. You'll start having people do automatic into the plan based on what they did last year, unless they come to you with a change. And as we all know, it's impossible to get people sign anything. Most people will forget, and they won't actually change anything. So you'll start moving to a core plan that everybody elects. There's going to be exchanges. People are going to start buying their own insurance. I appreciate what you bought for me. I don't really like it. This plan's better for my family. I want to use this one. So people will not be beholden to your employer system. There's going to be limited or 60-day notice you have to tell them about. So open enrollment's going to move from this 45-day window that you have to make an election probably to I'm going to tell you about the plan on October 31st. If you want to change anything, you've got to inform me by 12/31. No longer meetings and a bunch of information. There's going to be limited choice. Whether you like it or not, the marketplace is going to constrict. If you ever bought a plan through an association, that's what you're going to see. We have a $500 plan, a $1,000 plan, a $1,500 plan, a $2,000 plan. There's going to be no more of this, I got my trend and it was 28%. What if I tweak the copayment by $5 and I tweak the deductible by $100 and I take out this coverage here and I'm not going to cover naturopaths anymore? What's my impact to trend or my rate increase? That's going to be gone. You're going to have very specific insurer policies, and that's what you get, and that's how they're administered, and that's it.